Hi, I'm Chris Dickson, a vascular surgeon at Vascular and Vein Specialists of Greensboro. The purpose of this video is to help you understand venous disease so that together with your physician, you can decide how best to prevent and treat vein problems. Although venous disease is very common, vein problems in general are not serious or life-threatening if they simply involve the superficial veins. Blood clots in the bigger, deep veins are more serious, but the focus of this video is on the superficial veins. Let's start by learning a little anatomy and talking about how veins work. First, it helps to understand the difference between arteries and veins. The heart pumps blood through your arteries to your extremities, and the vein then returns the blood back to the heart. The main superficial veins in the legs are the great saphenous vein and the small saphenous vein. If you have large ropey veins in your legs, these are called varicose veins. They are typically branches off one of these other two superficial veins. The challenge that veins have in the legs is that they must work against gravity to get blood from the feet all the way back up to the heart. In order to accomplish this, they have valves that keep the blood moving in the right direction back towards the heart. Because veins are under pressure, gradually they can get bigger and then those valves can leak, which results in blood moving in the wrong direction. This is called venous reflux. You will likely have an ultrasound study done so that we can look for this venous reflux. If you have venous reflux, this can create high pressure in the veins and stagnant venous blood flow. It's this high venous pressure that causes the symptoms of venous disease. Those symptoms include aching, heavy, tired feeling in the legs, and leg swelling. More advanced venous disease can cause discoloration of the skin and even leg ulcers. If you have valve problems in the superficial veins, the great saphenous vein, for example, and if they are causing symptoms, this can be treated with a procedure called laser ablation, which we will get into in just a minute. Now that you understand some anatomy and how the veins work, let's discuss how to prevent and treat vein problems. Let me review 5 things that you should make part of your daily routine to help relieve your symptoms and prevent progression of venous disease. First, try to avoid sitting and standing for long periods of time. For the venous valves to work that we talked about, you have to be moving. When you're just sitting or standing, those venous valves are open and the blood can go in the wrong direction, creating high pressure in the veins. When we are moving, the calf muscle squeezes the vein and pushes the blood back towards the heart. This is called the calf muscle pump. Second, for the same reason, exercise is good for the veins. Walking especially is good for them. Again, when you're walking, the muscle squeezes the vein and helps push the blood back towards the heart. But any type of exercise is helpful. The third thing to consider is wearing compression stockings, especially if you're on your feet all day or sitting all day. Compression stockings squeeze the legs and push blood in the superficial veins into the deep veins, which is a more efficient way to get blood back to the heart. Compression stockings are also tighter at the foot and looser as you progress up the leg, and that pressure gradient helps push the venous blood back towards your heart. The important thing is to make sure that they fit comfortably. Your physician will help you select the compression stocking that is best for you. The fourth thing to make part of your daily routine is leg elevation. When you elevate your legs above your heart, you lower the pressure in the veins and can take advantage of gravity to get that venous blood flowing again. The catch is if you don't elevate your legs correctly, it doesn't help. This is the most effective position to elevate your legs. First, your back should be flat so that you're elevating your legs above your heart. The biggest mistake that people make is that they sit up in their recliner and elevate their legs. But in this position, their legs are not higher than their heart. Second, be slightly bent. If the knee is fully extended, the vein behind the knee can be compressed by the bone and block venous blood flow. Finally, the ankle should be higher than the knee, so the lower part of your leg is tilted and you can take advantage of gravity. If you elevate your legs correctly like this, you will flush out the stagnant venous blood which is accumulated during the day and reduce swelling. You should try to elevate your legs for at least 15 to 20 minutes every day. Doing this at the end of the day is probably most helpful. Finally, it is important to maintain a healthy weight. The weight of our belly especially increases the pressure on the veins in our abdomen, which increases the pressure in the leg veins. If you want help trying to lose weight, ask your physician. Next, let's talk about treatment options for treating reflux in the superficial veins, which we just discussed. People who have symptoms related to their venous disease and have documented leaky valves in the superficial veins may benefit from a procedure called laser ablation. In the past, we removed the veins by stripping them out. We now have a better method. In an office setting, we start an IV in the vein and introduce a laser fiber into the vein. The area around the vein is then anesthetized. Then by pulling the laser fiber through the vein, this causes the vein to clot and injures the lining of the vein. Then gradually over time, the vein scars down so that the venous blood can no longer move in the wrong direction. This can help lower venous pressure and relieve symptoms. If you elect to have this procedure, the risks are very small. There is a less than 1% risk of getting a blood clot in the deep veins and a less than 1% risk of the vein not closing completely. You may also see some mild to moderate bruising after the procedure. In order to qualify for these procedures, insurance companies require a 3-month trial of thigh-high compression stockings with a pressure gradient of 20 to 30. Of note, if you do not like the thigh-high compression stockings, you're not wasting your money because you will have to wear them for 2 weeks after the procedure. Before approving laser ablation, insurance companies also require you to attempt other conservative measures, including leg elevation and exercise. In addition, insurance companies require that the vein being treated be sufficiently large to qualify for laser ablation. In addition to laser ablation, larger varicose veins that we previously discussed can often be removed through small incisions at the same time. This is called stab phlebectomy. Again, all the areas that are involved are anesthetized. Then through very tiny incisions, the vein is grasped and gently removed. Steri-strips are applied over these small incisions and no sutures are required. Hopefully this video will help you better understand how veins work and why vein problems are so common. Together with your physician, you can take steps that will help maintain healthy venous blood flow and keep your legs feeling their best.